Okay, let's dive into this explainer. Today, we're looking at what has to be one of the absolute highest stakes scenarios in all of neonatal medicine. We're talking about those critical, nail-biting moments right after birth where literally every single second counts. And the medical decisions being made, they can entirely alter the trajectory of a newborn's life. Our focus today is on Hypoxic-Ischemic Encephalopathy, or HIE. It's really the ultimate medical mystery, and honestly, an incredibly intense race against the clock. Just picture this. A newborn is entering the world, but during the delivery, that vital supply of oxygen is somehow compromised. How do doctors jump in to stop a devastating cascade of brain injury when the oxygen suddenly runs out? Well, that is exactly what we're going to unpack for you today. To get there, we've got a really clear roadmap. We'll start with the threat of hypoxia, move right into identifying the injury, and then we'll break down the 6-hour window. From there, we'll dive into the cooling protocol itself, and finally, we'll look at prognosis and outcomes. Section 1. The threat of hypoxia, when the oxygen runs out. Before we go a step further, we really need to break down this intimidating acronym, HIE. So it stands for Hypoxic-Ischemic Encephalopathy. Hypoxia simply refers to impaired gas exchange, so a lack of oxygen. Ischemia means decreased blood flow. When you combine those two, it causes a profound hypoxic ischemic injury to the newborn's tissues. And the encephalopathy part basically describes the resulting clinical evidence of that brain injury, so an abnormal neurobehavioral state. Now, this process triggers Mother Nature's built-in triage system. It's often called the diving reflex. When oxygen first drops, the newborn's body automatically triggers a response to redistribute cardiac output. It literally shunts blood away from non-essential areas to fiercely protect and prioritize the brain, the heart, and the adrenal glands. But if that hypoxia goes on for too long, this amazing compensatory mechanism fails and severe tissue injury begins to set in. Section 2. Identifying the injury, the frantic first hours of diagnosis. In those frantic first hours, clinicians basically act as medical detectives, racing against time, looking for very specific clues. They're checking for abnormal consciousness. So is the baby profoundly lethargic or maybe strangely hyper-alert but totally unresponsive? They're rapidly testing for absent brainstem reflexes, like the pupillary or gag reflex. They're looking for hypotonia, which means abnormal floppy muscle tone. A weak or totally absent suck is a massive red flag, and so is apnea or any kind of abnormal breathing pattern. But here's a truly terrifying aspect of HIE. The danger is often completely invisible to the naked eye. Over half of newborns with moderate to severe HIE will actually experience seizures, but they're often subclinical. What does that mean? It means there are no physical convulsions at all. The seizure is only happening electrically, deep inside the brain. Because of this, doctors absolutely must rely on continuous video EEG monitoring to detect and immediately treat these hidden, damaging electrical storms. Section 3. The 6-hour window. The race against time. So, the crucial point is that doctors are working against a remarkably strict clock here. This timeline, this is the absolute centerpiece of modern HIE treatment. From the exact moment of birth, minute 0, doctors have strictly less than 6 hours to initiate their treatment protocol. If they manage to hit that incredibly tight window, the infant is then maintained at a highly specific cold temperature for a full 72 hours. And then, finally, there's a super delicate rewarming phase that takes between 10 and 12 hours to complete. Section 4. The cooling protocol, slowing down metabolism. To really grasp how revolutionary this protocol is, we have to look at the historical standard of care. In the past, treating these asphyxiated infants was mostly just supportive, managing their fluids, helping them breathe, which tragically resulted in devastatingly high morbidity. But then, induced hypothermia changed everything. This is active, controlled cooling. And today, it stands as the singular, proven neuroprotective treatment for a hypoxic ischemic injury. It is literally a modern medical marvel that drastically improves both survival and long-term neurodevelopmental outcomes. Now, what's really interesting about this slide is the exact number, 33.5 degrees Celsius, or roughly 92.3 degrees Fahrenheit. Think about that. That is incredibly cold for a human core temperature. The infant is deliberately kept at this starkly cold baseline to aggressively reduce the brain's energy demands and to suppress those damaging inflammatory responses that cause secondary brain injury. As you might guess, managing this protocol requires intense, relentless monitoring. The cooling process can actually begin passively right in the delivery room, just by doing something as simple as turning off the overhead warming lights. Once the active cooling officially begins, the baby's core temperature has to be checked every 15 minutes to prevent overcooling. Many centers prefer total body cooling because it allows for that continuous video EEG monitoring we talked about. And fascinatingly, this hypothermia protocol actually delays a phenomenon called pseudonormalization on early MRI scans, which completely changes how doctors have to read and interpret the imaging data. After 72 hours of being cooled like that, you can't just warm the infant up rapidly. The rewarming phase is incredibly delicate. We're talking about a painstaking rate of just 0.5 degrees Celsius every 2 hours. That's exactly why the process takes 10 to 12 hours to safely bring that tiny baby back to a normal 36.5 degrees. If they rush the rewarming even a little bit, it can trigger sudden, severe seizures or massive, dangerous shifts in blood pressure.
Section 5. Prognosis and Outcomes. Looking to the future.
Looking long-term, it's crucial to understand that the spectrum of HIE is not a monolith. The severity of the initial injury really dictates the outcome. For mild cases, the prognosis is actually excellent. Mortality is under 1%, and nearly 100% of these kids go on to have a totally normal neurologic outcome. But for moderate cases, things get highly variable, bringing a 20 to 37% risk of death or abnormal outcomes. And sadly, for severe cases, we see a high mortality rate and a significant risk of major neurodevelopmental disabilities, things like cerebral palsy or severe cognitive impairment. Let's move to and see how this builds when we look at the diagnostic tools used to actually predict those outcomes. Doctors rely heavily on three main things here. First, the EEG determines the severity of the encephalopathy and the total seizure burden. Second, an early MRI, done between days 1 and 5, looks for restricted diffusion as a really early indicator of injury. But remember that pseudonormalization effect, where the brain can temporarily look completely fine around day 7? Because of that, a late MRI is absolutely required between days 10 and 14 to detect the true severity and the exact location of any established, permanent injury. To really summarize the sheer gravity of this topic, consider this rock-solid medical consensus. Therapeutic hypothermia is the only proven treatment for hypoxic-ischemic encephalopathy and must be started within 6 hours of birth. It's a huge testament to how far neonatal medicine has come, for sure, but it's also a very stark reminder of the unforgiving nature of that initial 6-hour window. Which leaves us with this final, rather provocative thought. While cooling is currently our only proven weapon, as medical technology continues to advance, what other neuroprotective strategies might we discover to extend that 6-hour window? Could things like stem cell therapies or advanced pharmacological treatments eventually offer even more protection to the developing brain? It is an absolutely fascinating frontier in medicine. Thank you so much for joining me on this explainer, and as always, keep learning.